Imagine a United States where every single healthcare expense, from routine checkups to major surgeries, from prescription drugs to long-term care, is fully covered by the government. No more insurance premiums, no more surprise medical bills, no more copays or deductibles. In this scenario, the government would take on the role of the single payer for the entire healthcare system, essentially providing universal healthcare coverage for all Americans. This concept, often referred to as single-payer healthcare or Medicare for all, has been debated for decades. Advocates argue it would ensure that no American suffers or dies due to lack of access to medical care, while critics worry about costs, efficiency, and government overreach. But what if this became a reality? What would it mean for patients, doctors, hospitals, insurance companies, taxpayers, the economy, and the broader society? To fully understand the implications, we need to explore the history, structure, and current challenges of the U.S. healthcare system, followed by a detailed examination of the potential changes and consequences of a government-funded healthcare system. The United States spends more on healthcare than any other developed country, both in absolute terms and as a percentage of GDP. Despite this massive expenditure, millions of Americans remain uninsured or underinsured, facing barriers to timely and affordable care. Medical debt is a leading cause of personal bankruptcy, and health disparities persist across racial, socioeconomic, and geographic lines. Currently, healthcare funding in the U.S. comes from a patchwork of sources: private insurance premiums paid by employers or individuals, government programs like Medicare and Medicaid, out-of-pocket payments, and others. This complexity adds administrative overhead and creates gaps in coverage. Many Americans have employer-sponsored insurance, but coverage varies widely. Medicare covers most seniors and some disabled individuals, while Medicaid serves low-income populations in varying ways by state. If the government were to cover all healthcare costs, this patchwork would be replaced by a unified system. Every American would be automatically enrolled, with the government negotiating prices, setting standards, and paying providers directly. This would mark a radical shift in how healthcare is financed and delivered. One of the most immediate impacts would be on patients. Currently, many people delay or skip necessary care due to cost concerns. With government coverage, financial barriers would largely disappear. Preventive care and early treatment would become more accessible, potentially improving overall public health and reducing expensive emergency interventions. People would no longer have to worry about insurance denials or navigating complex benefit plans. For patients with chronic conditions, the burden of ongoing medication and treatment costs would ease considerably. The peace of mind knowing that care is guaranteed regardless of income or employment status could improve mental well-being and reduce health-related stress. Hospitals and clinics would also experience profound changes. On the one hand, a single-payer system would provide a stable source of reimbursement, reducing administrative complexity associated with billing multiple insurers. This could lower operating costs and allow providers to focus more on patient care than paperwork. Small practices and rural providers might particularly benefit from simplified payment structures. However, providers would face government-determined reimbursement rates, which could be lower than current private insurance payments. This might create financial pressures, especially for specialty care or high-cost procedures. Some hospitals might struggle to maintain profitability, potentially leading to consolidation or closures, especially in rural or underserved areas. Doctors and other healthcare professionals might experience changes in income and workload. While administrative burdens could lessen, reimbursement cuts might impact salaries. Physician supply could be affected depending on how compensation models evolve. However, many argue that removing profit motives from care could improve medical ethics and patient-centeredness. Insurance companies, as we know them today, would undergo massive disruption. With the government covering all healthcare costs, private health insurance would largely become obsolete for basic medical care. Some supplemental plans might survive, covering elective or cosmetic procedures not included in the government plan. The hundreds of billions currently spent on administrative costs, marketing, and profits by private insurers would be eliminated or redirected. This would have ripple effects on employment in the insurance sector and related industries, but could also free up resources for more productive economic uses. The debate over government efficiency versus private sector innovation would intensify, with advocates emphasizing potential savings and detractors warning about bureaucracy and lack of competition. From a taxpayer perspective, funding universal healthcare would require significant public expenditure. The government would need to raise revenue through taxes, whether income, payroll, sales, or other forms. The total cost would depend on program design, negotiation of provider payments, drug pricing policies, and administrative efficiencies. While individual out-of-pocket healthcare spending would drastically decline or disappear, overall tax burdens would rise. The question of whether the net financial effect would be positive or negative for different income groups is complex. Lower and middle-income individuals might save money, while higher-income earners could face increased taxes. The economic impacts extend beyond just direct healthcare costs. Universal coverage could increase worker productivity by reducing illness-related absenteeism and improving population health. It might also reduce employer costs as businesses would no longer have to provide expensive insurance benefits. This could make American companies more competitive globally and potentially encourage entrepreneurship by lowering the cost of employee benefits. On the other hand, some economists warn about potential inefficiencies in government-run healthcare, possible rationing of care, and longer wait times for certain procedures. The balance between cost control and quality of care would be a central challenge. Drug pricing would likely see major reforms. The government, as a single payer, could negotiate directly with pharmaceutical companies to lower prices, similar to how other countries manage drug costs. This could lead to substantial savings but might face opposition from the powerful pharma industry and impact innovation incentives. Technology and innovation in healthcare might also be affected. The profit motive currently drives much investment in new drugs, devices, and treatments. A government-run system would need to balance cost containment with incentives for research and development. Some predict more public funding for innovation to compensate for reduced private sector returns. Public health outcomes might improve overall. With universal access to care, disparities based on insurance status would shrink. Preventive care could reduce chronic disease prevalence and improve longevity. Mental health services could be expanded without cost barriers. However, addressing social determinants of health, such as housing, nutrition, and education, would still require coordinated efforts beyond healthcare financing alone. Politically, implementing government-funded healthcare would be an enormous undertaking. It would require major legislation, likely facing fierce opposition from entrenched interests like insurers, pharma, and some medical groups. Public opinion might be divided with passionate supporters and skeptics. Transitioning from the current system would be complex. Millions of people employed in healthcare administration and insurance might face job losses or retraining. State and local governments would need to adjust their roles, especially in Medicaid administration. International comparisons offer valuable lessons. Countries like Canada, the United Kingdom, and many in Europe provide universal healthcare funded by government revenues, often with better overall health outcomes and lower cost per capita than the US. However, each system has its trade-offs, including wait times, taxation levels, and access to certain treatments. In the United States, cultural attitudes towards individualism, free markets, and government roles complicate the debate. Trust in government administration and concerns about bureaucratic inefficiency are common obstacles. Ethical considerations are central. Many argue that healthcare is a human right, and society has a moral obligation to ensure everyone receives care. Others emphasize personal responsibility and market-driven solutions. The future of healthcare technology, such as telemedicine, AI diagnostics, and personalized medicine, could be influenced by the funding model. A government-funded system might standardize and spread access to these innovations more evenly, but could also face budget constraints limiting rapid adoption. Emergency preparedness and pandemic response might improve with a unified healthcare system that can mobilize resources nationwide more effectively. Data collection and public health surveillance could become more integrated and robust. Mental health and addiction treatment could finally receive adequate funding and integration into mainstream healthcare, reducing stigma and improving outcomes. Patient experience might improve as financial stress related to medical bills disappears. However, navigating a government system might bring new bureaucratic challenges. The healthcare workforce would need adaptation. Training, recruitment, and retention programs might be expanded to meet increased demand. New roles could emerge, focusing on preventive and community-based care. Healthcare infrastructure investments would shift focus. Emphasis might be placed on primary care, rural clinics, and underserved communities to promote equity. The pharmaceutical industry's business model would face disruption. Companies might need to innovate new strategies to remain profitable or rely more heavily on public-private partnerships. Hospitals might see shifts in patient volumes and payer mixes, requiring strategic adjustments. Financial stability could be challenged, especially for specialty and trauma centers. Medical education could be influenced by new priorities and funding mechanisms. Greater emphasis might be placed on primary care and population health. Public trust in the healthcare system might increase if access and affordability improve. Conversely, initial implementation hiccups could cause frustration. International relations could be affected as the U.S. shifts its healthcare model closer to other developed nations, potentially influencing global health policy discussions. In conclusion, a United States where the government pays for all healthcare costs would be a transformative and complex change. It holds the promise of universal access, reduced financial stress, and improved public health, but also poses significant challenges around cost, implementation, innovation, and political feasibility. The journey to such a system would require thoughtful planning, broad consensus, and commitment to balancing equity, quality, and sustainability. Whether the U.S. can successfully transition to government-funded healthcare remains one of the most pressing questions for the nation's future.